Aloha, friend. I'm Congressman Ed Case, proudly representing Hawaii's 1st Congressional District in Congress. And I'm coming to you tonight from my district office in downtown Honolulu. I'm joined by a special guest, as you can see, Lieutenant Governor and Dr. Josh Green, old friend and colleague of mine, and he's going to weigh in on obviously the medical issues as well as what the state is up to, and the other issues that we're going to deal with you here tonight. And I especially am grateful for all of you joining us tonight. This is a critical issue for all of us. I certainly wish I could be out there in the community with you personally, but as we all know, that's not the right idea right now, and so this is the best that I can do. We're going to Facebook Live. We're also being carried live on Olelo. Thank you to Olelo. Akaku on Maui. We're also being live streamed by KHON2 and a couple of other places. So thank you so much. A bit of how the evening's going to go. I'm going to speak for a while. Lieutenant Governor Green will give you his insights. We're going to have a conversation. This is something that we want to talk to you honestly and personally about, as if we were in your living room. And then we have asked you for your questions. We've had a lot of good questions up front, and you also have the opportunity to send us questions during this broadcast, so that we'll get those questions and we'll try to get them answered. We're, of course, well into the pandemic of novel coronavirus 2019, or what we refer to as COVID-19. And a pandemic means an international disease, a disease that is not confined to any one country or a few countries, but has swept the globe. And that's exactly what has happened. COVID-19 is now found in 166 countries, and we only have about 180 plus, so we're almost all the way around the world at this point. The latest impacts, we've had about 208,000 confirmed cases around the world. We've had about 8,700 deaths. Here in the United States, we've had 7,000 cases, and I think we've all heard on the news tonight that we had a significant jump in cases today, primarily in New York. But we are seeing still the escalation of that curve here in our country. We've had about 100 deaths so far, and here in Hawaii we have about 16 cases, and we get a few more every day. This is not only a public health emergency, because what was a public health emergency and needed to be treated as a public health emergency is now also an economic crisis affecting real people, real jobs, all of us, and none of us is immune to COVID-19. One way or another, we're all being impacted, some substantially more severely than others. And this requires really an all-world, all-government, all of us, full mobilization effort to get through this. And I think that we can and will do it if that's what we do. If we all hang together and work through this in a cooperative, focused spirit, we can and will get through this. And in fact, I would say that we have no choice but to do that. So the more that we argue and scream and yell at each other, the less we're going to get through that. And I think that we're well on our way to understanding that. I think the political dialogue, the cooperative dialogue, has been far better in the last couple of weeks as we've realized the seriousness of this crisis and started to focus as one world, one government, one community. I've got a couple of goals here tonight that I want to lay out for you. First of all, I want to tell you straight up what I know and what I don't know. I want to tell you what I think we should do and what we are doing. That's number one. Number two, I want to answer your questions straight. And where I know the answer, I'll tell you, and where I don't, I'll tell you that too. And we'll try to get the answers to you through my office. We all should have that information. We all need to know what's going on. And the more uncertainty that we have, the more fear we have. When we're going through a crisis together, we like to know what the crisis is. We like to know what the plan is. And when we don't know what that crisis is, and when we don't know what that plan is, that's when fear sets in. And the last thing we need here is fear. So this is about talking to you straight. And then finally, I need your input. We have major decisions still to make, for me in the United States Congress, where we've been dealing with these at breakneck speed, and back here at home, where I try to work with Lieutenant Governor Green and Governor Ige and all of my partners here in Hawaii on your behalf. And we all need to hear from you. What's going on in your lives? What do you think we should be doing? What is your direction? What is your situation? And just plain stay in touch, because, like I said, we're all in this together. And I can't sit up in Washington, D.C. in isolation from you and get anything done. I need to stay in very close contact. I want to go back to the basics, the medical side of this, the science side of this, the Lieutenant Governor Green side of this, because, again, Josh is a medical doctor, an emergency room physician, and he's uniquely suited, and that's why the governor has put so much trust in him to really run the public health side of this. Josh, if I can call you Josh here,
always.
Call me Ed, by the way.
Yes, of course.
I'm going to just ask you a couple of questions here, and I'll give you all the questions, and let's just walk through it. What is COVID-19? What are the symptoms? Why is it such a concern? What should we do, and how do we get through this? So what are we talking about again? It still surprises me that I do get a lot of questions about what the basics are.
Yes.
And that's fine, but we've got to all know what the medical situation is.
Thank you, Congressman. Thank you, Ed. Okay, basics. Coronavirus 19, called COVID-19, the CO for coronavirus. It's like a cold virus. The D, the COVID, D means disease. That disease is pneumonia, and 19 because it started in 2019 in China, in Wuhan, which is in the Hubei province. That's where the first epicenter of this was. So COVID-19. So it's a virus kind of like a cold virus. It spreads. Now, some of this is all in discussion because it's novel, right? So it's new. That's the point. It's
I'm going to just stop you right there because I think this is really, really important. Maybe you'll get into it later on. But This is a new virus.
Yes.
Cold viruses, flu viruses, they've been around for a long, long time. But viruses mutate. They change. They adapt to certain circumstances. And I understand that the reason this one takes hold in us so easily is it's mutated and adapted to hang out in the human body and do damage along the way. So the fact that it's new means that we have no real natural immunities to it and no vaccine, right?
Exactly. So no vaccine and not a full knowledge of exactly how it spread, although we're learning so much just from December. This is now, late March, right in the middle of March. It's only been like 3 months, but we're learning a ton because the whole world's focused on it. So it's new. It hits our body. It's in that same class of viruses as SARS and MERS were. And they were similar outbreaks, scared the heck out of us in like 2003 and 2010 or something, but it's similar to that. Now this one is spread through droplets. That means if you sneeze or cough on somebody, the droplets go out about 6 feet. That's why we tell people to stay about 6 feet away, right?
We're trying to be 6 feet away.
We're doing our best to be able to share. So that's it. It's a novel virus and it's droplets. Now, some people say, is it airborne? That means aerosolized and hangs out in the air for longer. We believe it's droplets. That's why we try to prevent the droplets and do it that way. So it's a novel virus. It's new. It's like a cold. The main symptoms, let's go to the basics, right? The main symptoms are fever. 88% of people who have COVID-19 have fever. So if you don't have a fever, you're already probably good. Probably good. 88% will have fever. Then cough, dry cough. Got a dry cough, that's now we're wondering. And then shortness of breath. If you can't get your breath, look, that's when you go to the hospital. Call your provider, but go there because you might be developing the D part of this, the disease, which is the pneumonia, and about 2.5% of all people who get COVID end up in deep trouble in the hospital, in the ICU. So that's the basics, right? Now, why are we so worried about it? It sounds a lot like the flu. It is a lot like the flu. Right now, 8 to 10% of the world every year gets the flu. But we have a flu shot, so we feel we have a little control over it.
We have a vaccine. We've seen the flu. The flu has been around for a long, long time. We've developed natural immunities. We also have a vaccine. So we have protection from the flu. And sometimes people say, well, why are we so worried about COVID-19? After all, far more people die from the flu, the normal flu. And first of all, obviously we want to make sure that this doesn't result in the deaths of that many people from the flu, but also we have ways of protecting ourselves from the flu.
Right. That's the control part. When we feel things are out of control, people panic. So I don't want anyone to panic. I want people to be mindful and conservative, but not panicked about this. And so we'll get into the special cases where we do spend even more concern. So like you said, you can get a flu shot, you can get immunized. Doesn't always work, but more often than not, it does. I'm not going to have an argument with people about that. We each make our own decisions. But there is no vaccination against COVID-19 right now. It's being worked on. There's no way that's going to be successfully implemented in this acute phase. It's going to take many months. They're testing it now, but that takes time. 6 to 9 months would be a miracle to get a vaccination. So it'll be good for next year, but don't bet on it this year. So right now it's going to be like social distancing, keeping away, being smart, not allowing everyone to get infected too quickly. That's the first thing. Now let's talk about the severity of COVID-19. Flu will kill a person or kills people about 1 out of every 1,000 people, more or less. So 1 in 1,000, and it's usually seniors, so they're sick. So if that is the case, we worry, but it's not devastating because illness gets us. However, COVID-19 has been killing 30 out of 1,000 people, or 3 out of 100, and that means it's, at this moment, considered to be about 30 times more lethal than the flu. Now, that number will drop down. It's only this lethal because we're not counting the many thousands or probably millions of people out there in the world that got a mild case that don't have any access to health care, no tests, no nothing. Over time, it'll still be more lethal than the flu, but instead of being this much more lethal, it'll be this much more lethal. Once again, no control, and again, it's taking our kapuna out more often. The mortality rate, they say, like I just said, is about 3%, but if a person is older and they're between 75 and 79 years old, the mortality rate jumps up to 8%. If people are 80 or older, it's been 14.4%. So that's why we're so focused on not letting the disease spread to our nursing homes, long-term care centers, and so on.
Now, why does it affect our kapuna more than others? Is it just because they naturally have an immune system that's not quite as capable anymore? That's kind of a definition of aging?
It is. It's the immune system plus the impact of pneumonia. When pneumonia gets people, it is very, very serious. And what people don't realize is the rate of death if you have pneumonia and you're over 80 in the hospital is about 25%. So if, God forbid, you end up with pneumonia and you're 83 years old, it's a very high mortality rate. You just don't have as much reserve. Your oxygenation, your oxygen to breathe in and out goes down, and if your oxygen gets too low because we can't beat the infection, then other organs start shutting down. That's what also happens with this. That, again, the COVID, the D, that disease part, pneumonia, is also the problem.
Now, a lot of times people talk about respirators, and one of the questions we have is, do we have enough respirators? What are respirators, and why are they so important?
Thank you. Respirators are also described as ventilators, or respirators, equally good. Those are the breathing tubes that doctors or paramedics or nurse practitioners will, in the hospital, put down our trachea. It goes through the mouth, we knock you out, put that down there, and breathes into the lungs. And then a machine keeps you breathing while the infection simmers down and is gone. If it's viral or if it's bacterial pneumonia, we give antibiotics. Let me give you the actual numbers, Congressman, because I know you asked for these. Oahu, we have a total of ICU beds, intensive care unit beds, 278, and we have 455 ventilators available to us. On Kauai, we have 9 ICU beds and 18 ventilators. On Maui, we have 29 ICU beds and 27 ventilators. And on Big Island, we currently have 24 beds, ICU beds, and 39 ventilators. And the total numbers, if you add them up, and there's some extras hanging around, statewide, we have 3,000 licensed hospital beds. We have 340 intensive care unit beds where we can give a lot more care, and 561 ventilators. We can pump those numbers up maybe about 30% if we cancel elective surgeries, we turn the surgical theaters into intensive care units, and we use the ventilators that we use for surgery, same kind, for the care of people with COVID-19. So we could surge. But in answer to your question, do we have enough? I would say it's fair to say that no state has enough, and everybody's trying to get them. So the idea of social distancing, slowing down the disease so we get some natural immunity, far fewer cases at any one time, we can then accommodate everybody. That's the goal.
Now, that brings up a point that I think a lot of people are still confused about, the term flattening the curve.
Right.
Because I actually had somebody say to me the other day, well, if it's the flu and if we want to deal with it, why don't we just all get sick? And of course, that's a really, really bad suggestion for the folks that would do really badly. And
yes.
The rest of us can get sick and get an immune going. And why is that such a disastrous way of looking at it from a flattening the curve? What does that really mean, flattening the curve?
That means spreading out the COVID-19 cases over, say, 4 or 5 months rather than doing it all in 2 months. A lot of the countries that got crushed were, for instance, Italy. It came a quick spike. They didn't know it was in their midst, and then bam! Because the quick spike, they had thousands and thousands of cases, and they, like us, had limited numbers of ventilators.
So it overwhelmed their healthcare system.
And then they were making choices where they would say, do I put this person on the ventilator or this one? What's the best chance to survive? That's the kind of ultimate catastrophic triage that doctors never want to have to make. And they already are talking about that in Washington State. So we shouldn't just think about this as just over there in Europe. So by flattening the curve or spreading out the disease, we keep a constant flow of people who need our care, but we don't have a surge to the point where we can't handle it.
We're saying we know people are going to get sick from this virus, at least until we get a vaccine.
Right.
And we want to spread how many are sick over a longer period of time for a lower incident at any one time.
Perfect.
So that our healthcare system can accommodate that. And let's not forget that while our healthcare system is dealing with this, they're also dealing with all of the other things that the healthcare system has to deal with as you well know, in the emergency room, in the intensive care unit. So flattening the curve is all about spacing this out over time.
Exactly right. And there's other benefits. One benefit, like I mentioned, is we will get some natural immunity, antibodies, just because it's in our midst. Disease cases are in our midst. So we can get some immunity without even getting the disease. So that's very good. That's called herd immunity. You can start getting that, or passive immunity. Another thing, you're reading already, everybody's on the internet, and some of what, maybe 5 to 10% of it is accurate, okay? But they are working on different treatments. They're now looking at chloroquine, which is a classic treatment for malaria. And smart people who do these kind of studies are doing it quickly. They're trying to find out if that's going to work. There's an antiviral that's coming out of a company. They're trying to see if that will work. So if we are later than most, which we usually are, flu always comes to Hawaii about 2 months later, so viruses in general, I think it's just based on our longitude and latitude and how long it takes to get things to us here in Hawaii. If we're a little later, which is why we're trying to damp down the borders and slow down spread, we may benefit very significantly, because if we get hit 3, 4, 5 months later, we may benefit from the world's research and experience on what will work.
Yeah, I think that's really an important point, because sometimes people, of course, the idea that there's no vaccine existing and it'll take a year and a half to perfect it, that's a scary thought. That's like saying, well, I'm going to be exposed and at high risk for a year and a half. But we also forget that we have had many, many other areas of research and drugs and vaccines, and as you put it, antivirals that go after viruses,
Yes.
that have had application to other diseases, other viruses, and we are looking very desperately around the world right now, getting out those drugs and vaccines and from ice banks, and you see the foam coming out of them on TV, and that's all about saying, well, okay, fine, we've got this new virus, it's been mutated, so it's technically new, but is it similar enough so that we can actually use something else to make a dent on it?
Perfectly said.
Okay. So what do we do? What's the plan from a public health, medical emergency perspective?
So from an emergency perspective, the best thing we can do is, first of all, have everyone make as many good decisions as possible. The very basics are irrelevant. Everybody should absolutely wash their hands a lot, and wash them for a full 20 seconds, because the number of times you touch other people, your own face, surfaces that may for minutes to hours or even a couple days have had the virus on them, you can then contract it yourself if you touch your own mucous membranes, your eyes, your nose, your mouth. It's unbelievable how often we do this. People can probably count what the number of times we're doing it on this hour and a half program.
I actually did count the other day, just because I just wanted to know, well, what's my natural habit? And it's
amazing. It's a big number. So first of all, wash your hands. Second of all, preparing for the state. We are now pretty much shutting it down. Social distancing is critical. Since there's no vaccination, social distancing means keeping events to a minimum where there's a lot of people together. So 10 people or less is what the world is heading toward. Whether or not we've said officially 50, it's 10. That's the number that people are headed toward. Don't have a wedding ceremony right now. It's just better to do it in a little bit of time, because again, our older seniors, we will survive it most of the time if we're younger. But if our kapuna get it, they're in trouble. So social distancing, huge thing. Testing. We have to get an idea of where the cases are. The Department of Health is able to do some modest amount of testing. They're really only able to do about 250 tests per week. They have to reserve most of those tests for people in the intensive care unit to make sure, are we taking care of the person the right way, and are the staff that's taking care of them, are they fully gowned up properly? Are we using our resources right? The private sector now has been launched. Last week I worked, and this is mainly my job at the governor's behest, to work with all of the private sector, all of our hospitals to stand up. These are regional testing centers. So at all of our hospitals, they put up a tent where you can go in there. You should only get tested. Let me say this very clearly. Only get tested if you're having some symptoms. Fever, cough, dry, shortness of breath. Or you were in direct contact with someone who is an obvious high-risk case. They just came from an area that was very high risk, or they have it themselves. If you don't have any of those symptoms, we'll reassure you, but you should not get tested. You will test negative, even if it's coming soon. So the testing is important to give us a map so that we can...
One of the questions that we got was, why are we spending so much time and money on testing? I mean, why test? I mean, that seems to be such a basic question, but, I think that it's worth, it's a legitimate question. Why do we, you made reference to Italy earlier on, where they tested.
Yeah.
It would seem to me that we want to know who has it and who doesn't have it so we can actually treat it.
We do, because that's it. Because so much of, first of all, it's human nature to need to know. If you don't know, you can't function. That's one very basic thing. Also, knowing that you are negative could be very valuable if you work in the healthcare industry, if you have to go to work, if you are in a situation where you have no choice but to be near your kapuna. Because a lot of people, in Hawaii, we may live in a 2-bedroom apartment and have 5 of us, 6 of us. Maybe we have our grandmother that's living in one of the rooms and 2 of the keiki live there and stay in that room with her. Very common. So we have to have some knowledge. We also have to know who is spreading it. Right now, kids aren't getting sick, but they may very well be carrying the virus. In that case, that's why schools have been canceled. Could they be spreading it completely universally, and then they add it to people who are more senior? So there's lots of reasons to test. Some people argue that there's been too much focus on testing. I will tell you whether that is valid scientifically or not, it is a moot point, because human nature requires knowledge. We will still treat people the same way. If you have symptoms, even if it ends up being the flu or a cold, you do want to isolate anyway. Do not go to work if you're sick. Do not go to school if you're sick. Schools have been closed. But still, it's worth getting a test if you have the core symptoms, because then we can really focus on isolating that person no matter what.
And you talked about human nature and the need to know. Okay, so I've got a kid, right? And my kid has no symptoms, absolutely no exposure. I'm fine. Everybody around my child is fine. The family is fine. But I just want to know, why shouldn't I be able to get a test?
There are some finite resources. That's one of the realities. I had that question come from a lot of people who had their children returning from college in Seattle, where there was this big surge. And my answer to them was, well, first of all, if they get the test with no symptoms, here's the way viruses work. When they're in your body, until you start demonstrating some symptoms, when you start getting the runny nose or the cough or the fever, you're not shedding the virus until you start having those symptoms. Maybe a little bit before, but not much. And maybe a little bit after, but not much. When you have those symptoms, you will light up your test, and you will also be much more contagious. But testing people, just everybody. Look, if we had universal money and as much test as you could possibly imagine, sure. Then we could test every last person. But we still had a finite number of tests.
Yeah, I think that's, and I said I was going to be, honest on this show, and one of the basic reasons is we don't have enough tests.
Yeah.
We got caught flat-footed with too few tests when this virus came at us, and we're, of course, scrambling to get as many tests as possible. But for now, as those tests get out and out into communities, there is a shortage of tests still to test people that may well be symptomatic, and so we've got to save them for them.
We do.
So we can't just, get anybody tested that wants to. That's the reality of it.
And there are some other considerations too, because once somebody is in a hospital, if someone orders the test, then essentially you are committing yourself to putting them in isolation. We only have 166 isolation beds in the whole state.
You're talking about once they take the test, they should quarantine for 4 days until they get the result.
Correct. And
also, I think another issue, as I recall, is that every time you give a test, you have to use protective gear, some of which you cannot circulate. We've got challenges with adequate protective gear, so you're really eating up some legitimate protective gear testing and personnel, of course.
Right, and so there's many points that I should clarify there. That's right. So we can get the same day test if you're in the hospital, but a finite number. Otherwise, it takes 4 days. Soon, all of our labs will be able to do them same day, which is a good thing. We also get a lot more tests, and industry will get it to the point where we can do more rapid tests. All these things come real fast when you have this much resource, billions and billions of dollars being poured into one challenge, which is a good thing, I think. Number 2, the personal protective gear. That's why we set up the regional testing centers. Let me be really clear about this for people. I hope everyone understands this. Doctor's office, solo doctor's offices. If you go there and ask for a test, and they have to test you, it's probably one set of personal protective gear. They can test you, and then they probably have to take it off for the rest of the day because they only do 1 or 2 tests. So that is a terrible use of personal protective gear. We want our private docs to be able to just provide basic health care. Then in the hospitals, we don't want people going to the hospitals for basic testing. We want the hospitals to be available for severe disease if people are really having trouble. So again, separating. So how do you test? You have regional testing centers where if people make the criteria, basically the same things, fever, cough, and shortness of breath, or a serious contact, concerned contact, then you have one person in protective gear. They can test a bunch of people. They might test 75 people, and we only use one set of personal protective gear. Also, we can keep them isolated from one another. We do the drive-through when we're doing it at our best. We change gloves if we need to, but it's a simple swab, in and out, done, and on you go. That's the mechanism to keep our ERs available for really sick people, our clinics available for, I've heard people having to cancel clinic visits because they just don't have the wherewithal to keep people separated. So we have to be smart about this. We also have to deal with reality, which is people need to have some knowledge. We don't have to know every single person that's got it or is negative, but we have to have a basic public health understanding. And if we're being honest, we did far too few tests in the first 3 weeks, mostly constrained by the fact that the CDC, like you said, were flat-footed and they didn't get it out.
Yeah. Okay, so in the big picture, from a public health emergency, medical emergency, kind of what's the plan for the next couple of months? So, obviously we have to social distance to reduce the new incident, to try to essentially dry this virus up, right?
Yes.
We don't want the virus to be able to go into more people.
Right.
We obviously need to treat the people test the people that may be sick.
Right.
Treat the people that are sick that need treatment.
Yes.
Find the resources, medical resources, to help them.
Yes.
Isolate those that don't need to be in the hospital, but they should be self-quarantined.
Right.
And we need to bend that curve, and we need to come over the top of that curve. That's really what we're looking for, right?
Yes.
And we've seen that in China, for example, which has spiked
Yes.
dramatically in about the middle of February, but it's come over the top. And South Korea has done that too.
Right.
In our country, we're still going like that.
Yes.
And in the state, we're still going like that. So we want that curve to come over the top, right?
Right. Exactly. And so we do all those things and come over the top of the curve, and we won't let our guard down, but we'll feel greatly relieved. And so we're monitoring through the Healthcare Association of Hawaii. It does very good work. They're in full partnership at the top level with the government to make sure we know from every hospital perspective, all 180 hospitals or so and long-term care facilities, where they are, the number of people, how many ICU beds are used, how many ventilators are available, all this stuff, right? So once we come over the top of the curve, then from a health standpoint, we can at least breathe a sigh of relief. But meanwhile, I know, and this is one of your greatest strengths, is looking at the economic questions, right? And so I'm going to defer over to you in a half second.
I appreciate that.
Yeah, that is the next big crisis, because there's all these huge questions which you're diving into, and we have to so isolate ourselves for 6 weeks or maybe a little longer. Then what's the impact on business and economy?
Well, that's exactly right, and happening all around the world. So thank you for that handoff to me. And we'll come back to kind of some of the state actions that you're very much a part of, especially and not just on the public health side, but on the economic side. So what I want to do now is switch from the medical public health side of this, the state side of this, the Hawaii side of this, to what's happening in your federal government, where I have the responsibility to represent Hawaii along with my 3 colleagues. And I think I would characterize it that your federal government, your Congress, your president, have, and your entire administration, all of the tools of the federal government, all the branches of the federal government, have basically 4 areas that we are very much focused on right now. The first is science and medicine. Have we adequately funded, and are we adequately pursuing all of the research, all of the science, all of the development to understand this particular virus and how to fight it? And that effort is ongoing right now, and we need to continue to pursue the science and the medicine side of it. We need to make sure that our healthcare system can handle those people that are sick, that do become sick, and to handle the testing of these people. And that is a very significant challenge, as Josh has already talked about. The third area we need to focus on gets in more to the economic crisis that we're facing as a result of this, because the impact on our businesses, on our jobs, on on our communities has been severe, as essentially what's happening is that the public health solution mandates people withdrawing in many ways from our economy. And when that happens, people don't spend money. They don't go out there and travel. They don't go out there and buy things that they don't circulate around. They don't go to restaurants, and that's what we have to do. And there's a hard hit because we have to do that. And so as a result, our social safety net, the safety net that we use to protect people, especially those in need from circumstances like this, simply gets incredibly strained, and we've got to boost that up. So that's our third area of focus. And then the fourth area of focus is simply to stabilize our economy, simply to make sure that it doesn't deteriorate, that we have the resources to get ourselves through, hopefully, this flattening of the curve so that we get to a more manageable situation and our economy can feel comfortable functioning again. And so those are the four areas that we have dealt with: the science and the medicine, our healthcare system, our social safety net, and our stabilization and recovery plans. We have passed in the United States Congress two major bills just in the last couple of weeks. You may have heard about them in the media, but I wanted to cover them with you briefly here today. The first, which passed early this month, was the Coronavirus Preparedness and Response Supplemental Appropriations Act. Fancy way of saying that we appropriated or we authorized to be spent on an emergency basis. This was a measure that came through my Appropriations Committee. I serve on the Appropriations Committee that funds federal government, $8.3 billion in emergency monies to go directly out to combat coronavirus. That money was more on the science side and some on the small business side. It went and is going to developing that vaccine we talked about. We definitely were caught, as I already said, short with a number of test kits. It went to fund the development and distribution of sufficient test kits throughout the country. That, frankly, is unfinished business as we sit here right now, as we've discussed as well, but at least it's better than it was. We were really caught with hundreds of thousands of test kits when we needed millions. Now we're up into the distribution of millions, but still not enough. The third area was medical equipment. We talked about ventilators. We have shortages, or more accurately, we could have major shortages if we see a, quote, surge in our country, a tremendous spike up in that curve that starts to overwhelm our healthcare system. So do we have adequate medical equipment? Have we taken care of our healthcare providers and what they need to take care of us? And then finally, help for small business. I'll come back to that. That's a really, really critical part of our package and our help right here in Hawaii that is very much in a dire situation right now. And I'll come back to small business. So that was the first bill we passed. That bill was passed by the Senate as well and was signed by the President. So now we're implementing that particular bill. The second bill is referred to as the Families First Coronavirus Response Act. We passed that out of the U.S. House last early Saturday morning. I voted on it about 1 o'clock in the morning and then got on a plane to come home. And then the Senate took it up this week, passed it today, and the President actually just a couple of hours ago signed that bill into law. And that is designed very much to start to get to the human cost of the coronavirus, the social safety net. This is to take care of families' food, health, and income security. Because when the economy is stretched to its breaking point like this, when people start losing their jobs, when we have less money floating through the economy, people start to lose the benefits of adequate nutrition across the board, especially those in need. Certainly, health security is a major issue. Do you have health care insurance, medical insurance? Can you get to a doctor when you need? If you're not, especially if you don't have a job, can you actually get that health care insurance? And finally, income security. How do you keep your cash flow going? How do you sustain yourself when you have bills to pay? So we went after those areas in the Families First Coronavirus Response Act that was just signed into law. And it has a number of very, very important provisions in it. First of all, it boosts up nutrition programs, especially for women, children, or kupuna, those in need. It takes care of the school lunch issue. You know, we talk a lot about school not being in, and we forget sometimes that for a large percentage of the children in our country, the school lunch program, which is our federal government's support especially for lower income kids who don't eat adequately at home, is really the only nutrition they get. So if they don't go to school, they don't eat school lunch. And so obviously we had to address that, and this bill does exactly that, provides alternatives for them to get that nutrition. Also enhanced SNAP assistance, so what used to be called food stamps, nutrition assistance for those in particular need. Family and medical leave, paid medical leave, paid sick leave. In many parts of the country we're used to that because it's a matter of state law, but it's not a matter of federal law. You don't automatically get paid sick leave, and of course we don't want people to have to choose between their job, being sick at their job, and being home without any pay. And so it's critical that if somebody thinks that they have coronavirus or is sick with it and stays home, they should not be penalized for that. They're after all, they should stay home and they should not impact the rest of us, and it's the right thing to do. So this has, for the first time, a federal component to paid medical leave. Unemployment insurance. We, of course, have unemployment insurance under which if you're laid off your job, or if you're partially laid off your job, meaning a significant reduction in hours, the state steps in with federal government subsidies to help you with a basic income. It's not very much, but at least helps you to buy some food and hopefully have a place to live. And that's a critical benefit for many, many people throughout our country. And that unemployment insurance program is particularly strained right now, and this particular bill boosts that up. We also went to free testing because we found that some of the testing that was going on, some of the companies out there were charging perhaps a bit too much. And after all, we want everybody to be tested who should be tested, so we don't think that income should be an ingredient of that. So this was really a major second bill that we passed. That's not going to be enough. The first bill went after the science and the small businesses. The second bill went after really the impact on families, but the unfinished business, besides the battle against the virus, both in the scientific community and the healthcare community, to deal with it as a public emergency, is to deal with the economic devastation that it is causing throughout our country. And so, as we speak, we in Congress are discussing with the President and with many, many organizations across our country. I spoke today to many of my colleagues right here in Hawaii, in the community, to come up with a major recovery stimulus stabilization package for the economic side of this, because again, this is a devastating event for many, many businesses, for all businesses really, I should say, and of course for everybody that's employed by businesses and everybody that's dependent on people that are employed by businesses, and all state and local governments who are dependent on economic activity to fund social and public needs through taxes and public spending. So we're talking about a huge bill, somewhere in the range of $1 trillion. That's a lot of money. $1 trillion is a huge amount. And we are trying to figure out right now what is the best structure to spend that $1 trillion. There are many different ideas. We have ideas from other comparable situations, not quite as severe. You may remember, for example, that there were times when our auto industry domestically was on the ropes, and we came in with a stimulus package specific to the auto industry. The auto industry survived that. We learned some lessons. Same thing happened with the airline industry. We also, of course, had the Great Recession in 07, 08, and that was a major stimulus, and we hopefully learned some lessons from that. But this is a different challenge that we're facing. In those situations, what was really happening was we were trying to jumpstart consumer demand. So in other words, consumers didn't have trust in the product. They weren't spending their money during that period, and so we tried to incentivize that spending. But if you incentivize spending in this situation, and nobody has anything to spend it on because they have to stay at home for a while, then you're not going to help in the same way. So we have to think about this one much differently. We also have much more dire, much more immediate needs, some of which I'll talk about. So what is really, really top of mind to me right now is getting this next stimulus package done correctly, not just for our country, but for me the focus has been very much on, okay, fine, if, for example, in the travel and tourism industry, our number one industry, which of course has been especially hard hit by coronavirus because we don't have any visitors coming. And by the travel and tourism industry, we're talking not just about hotels, we're talking about restaurants and bars and tour attractions and all of the other people that help our travel and tourism industry. The challenge for that industry nationally is going to be the same from Hawaii to New York to San Francisco to some of our other areas. We, of course, in Hawaii are very unique, so my challenge has been to ask the question, well, what's different about Hawaii that I've got to really go out and chase the particular issues that get those into the stimulus package. So that's pretty much my week this week, is the economic side, in addition to helping Lieutenant Governor Green and our state folks on the specific response to coronavirus right here. I want to talk about a couple of special issues, and then we'll start to get back to Josh, and then go to questions. I want to talk small business right now. Small businesses are just incredibly devastated. We're talking about the backbone of our Hawaii economy. We have one of the highest percentages of small businesses of any state in our entire country. Well over 90% of all of our businesses are small businesses. We have one of the highest percentages of small businesses that are sole proprietorships, so they're mom and pop operations. And these small businesses don't have unlimited cash supplies. In fact, by some calculations, our small businesses throughout our country maybe have 25, 27 days of cash to survive, and it's much smaller than that with restaurants who operate on a more narrow margin, so maybe 14, 15 days. We're already well into this. So you can see that for them, this is an incredible crisis, a crisis of no business, no cash flow coming in, no real reserves. Many of these small businesses do not simply have the same resources to borrow from the banks and financial institutions that some of the bigger businesses do, that have more credit, more resources, more collateral. And so the small businesses of our country are really in dire straits. And the first bill that we passed in Congress included a provision which I very much supported to support up to about $7 billion of loans from our federal government to small businesses, simply to keep them afloat for a couple of months to get through this time. That was passed, and the challenge has been here in Hawaii to get the declaration necessary to free that money up. And I just talked with the state administration today. We've been working with them on that for a couple of days now, and that declaration is now gone to the Small Business Administration. We're hoping to get approval on that within 2 to 3 days, and that should free us up for our small businesses to start to apply for that kind of assistance. I want to stop and thank everybody that responded to my e-newsletter yesterday, because what the state needed was support for the declaration that was made that there is, in fact, an emergency economic impact on our small businesses. And I asked you to communicate with our state to give them the ammunition they needed to do that, and it really worked. There was some confusion, which I apologize for, because many of you thought that was the actual application for assistance. That was not the application for assistance. That was to back up the state's declaration. We're going to let you know as soon as the application for assistance is available, so you can actually apply for that very, very fast. The census. When you're in a critical situation like that, I think it's important for us to, as much as possible, keep our institutions of government operating. And of course, this is a census year. The census is critical to all of us in our country, not only to count who we are, but not only to count how many we are, but kind of who we are. And that makes a difference here in Hawaii, because we're so unique. So many federal programs depend on kind of who you are. Whether you're ethnically diverse, and small businesses is one example. And so the information from the census is very, very critical to my job to try to assure that our federal government treats us fully and fairly. So along with many community organizations, you've been involved in this, LG, and the state, we want a full count in this census. The census is going on. A lot of people think that the census is about people walking around and counting. Actually, almost all of the census is by mail, online, and phone right now. And that's going on right now. You should be receiving that right now. What the census does is, if they don't hear from people through online and phone calls or whatever, social distancing methods, they would normally send out enumerators, they call them, people that go out, walk around neighborhoods and see what's happening. And of course, that's a very bad idea when we're in this environment. So the census has just deferred their enumeration, at least until the end of May. But it doesn't take away from the critical importance to answer the census as you get the opportunities to do so. You should be getting something by mail. You can also check 2020census.gov, 2020census.gov for information on the census, and I urge you and implore you to participate in the census, especially as you have time. I want to talk briefly about our veterans. Of course, we have one of the highest percentages of veterans in our country right here in Hawaii. And as you can imagine, veterans, a promise was made to take care of veterans and their families, and that's what the Veterans Administration does through our federal government. The veterans, of course, administration, of course, has been going through the same analysis. How do we protect our veterans in our hospitals? The Veterans Administration has just come out with some new rules in terms of who can come to the hospitals and veterans healthcare facilities. They're trying to make sure that they don't, of course, get the entire hospitals infected like other hospitals. And so please check out in advance whether if you need to go in for healthcare benefits. Check out in advance whether they prefer you to do this by telehealth or by online means or by calling your doctor. Similarly, for applying for benefits, the strong preference nowadays is for you not to come in unless there's just a real need, because again, we're trying simply to avoid that contact with each other. So if you have any questions about that, please let us know. I got a bunch of other issues here, and we're taking a lot of time here, LG, but I'm just going to say for resources on COVID-19, please contact my office if you need any help at all. My number here in my Honolulu office is 808-650-6688, 808-650-6688, or you can go to my website, case.house.gov for how to contact us. And also, if you look at the top tab on the right side, there's a COVID-19 tab there. There's a bunch of information on what we've talked about here. Talked too long, but I want to kind of get back to you, LG, and talk a little bit about some of the issues that the state is dealing with, and that, of course, we're trying to support the state. But one thing about battling COVID-19 is that really the front lines have been the state and county governments, and they've been doing an incredible job across the country. Some really tough decisions, some really good people that have, had to deal with the everyday consequences of how do you protect folks, very difficult decisions. And so I just wanted to ask you maybe to highlight some of the areas that are of particular concern to you and Governor Ige, and especially on the travel and tourism side, especially on the public health side, really anything you want to talk about.
Thank you again, Ed. So the key things right now is let's make sure our health comes through okay. So everyone is talking about all of these issues, and all the issues are critical. We have to have an economy after this, because the economy will pay for the hospitals and the ventilators that we'll need in the future and the testing and so on. So this is going to be a tough period, and obviously you guys are doing something extraordinary, which is full bipartisan work to get these packages out so that we have a future, we have an economic future, and so that whatever downturn there is shorter. It's ironic. We want the economic downturn to be way shorter, and we want the disease to be spread out so we can actually deal with it from a healthcare perspective. I hadn't thought of that until we were sitting together. On the health side, most of the health for viruses is preventing spread. So preventing spread means doing the right stuff. I'll come back to it again. Each of us can prevent spread pretty well by, if we're sick, not being too close to our loved ones for that short period when our symptoms are at their worst, by really going the extra mile, washing our hands, by getting flu shots if you're willing to do it. Those are the keys. Also now, the big questions for the state: when do you cancel things? It was a very, very hard decision. In my opinion, we have to lock it down right now, as we're doing, for this 2-week period. Basically, we locked down schools. It was extended till April 7th. So public schools, all the private schools, they're locking it down. Decrease spread. Restaurants and bars. Why, someone asked me today, do we lock down restaurants and bars for earlier than we lock down and shut down, say, places, retail stores? Well, if you're in a restaurant or a bar and you're sitting in one place for an hour or an hour and a half, and you are in close proximity, you are at higher risk to spread things. and also
simply a substantially higher risk factor.
That's
I mean,
right.
you know, we're having to make very difficult decisions on balancing the public health side and also not wanting an entire economy to crash,
Right.
an entire economy to crash. And so, you know, where are the areas where the risk is minimal, where we can actually maintain some economic activity? And by the way, economic activity is about people having jobs.
Yes.
And so, you know, can we strike those really hard balances? And so it's very difficult balance to strike in many areas.
Well, there's two things to think about in that context. So, any businesses that can work virtually can sustain their operations and do okay. So, any of you out there who are watching, if you can work from home or can work virtually, please do, if that's possible at all. That's very important, because for every cluster of cases that we prevent, it's another cluster of cases that don't spread and spread and spread. And then we get through this much better. And it burns out, and we have a high hope that because of our climate and because of the higher temperatures, this virus will break down. We hope that. That's been the case for many other diseases. So we're banking on that to a degree. So that's one thing.
So we want a hot summer?
We want a very hot summer. This is the hot one.
Last year was the hottest summer ever, and we were all complaining. Now we want it again.
I'll take it if we can get it. Okay, so that's one. And then you have the levers at the federal government, which is very good. So, for instance, I can imagine two people are watching us right now. One owns a little shop, and they're able to still do some business. They're maybe masked up. They're cleaning things down. They're still doing some business, so they don't have to fire everybody or lay everybody off. Whereas a bar or restaurant says, wait a second, you just told me I have to shut it down. Why are you treating me this way, even though I recognize there's higher risk versus the other individuals that may get to survive economically? I have children too. I have bills too. Well, that's the lever that you guys will have. You'll be able to direct resources, obviously, and to the best of your ability surgically. Like, maybe there will be cash payments to individuals, but maybe not. I don't want to suggest what's right or wrong. Maybe not to people who make $700,000 or $1 million.
Well, that's the challenge on the economic stimulus. Is to me the biggest issue is if we're going to spend that amount of money,
Yes.
are we going to get it to the people that actually need it? And you know, if you're talking about a bar and restaurant that had to close, that has no cash flow,
Right.
well, they obviously need it.
Yes.
And so that's the challenge is to maintain as much economic activity as is reasonably prudent from a risk factor. But then those that you know, we can't operate that economic activity, we help them.
Yes.
So everybody, presumably, hopefully, in an ideal world, is roughly the same over time.
This is why it's kind of funny that when people used to give you crap about being a blue dog Democrat and focusing on small business a little bit, because we're a little left-winger here in Hawaii, it's a benefit. Because all of your focus on sensible business operations is going to come and bear fruit now for us, because it is the small business community that is going to need your expertise. So we're lucky to have you, Ed. And that is going to be an obvious, huge focus. And since you actually know businesses because you spent innumerable meetings, I don't even know how you did that, going to all these people all these years, that's a big benefit to actually know one state. And that's why Congress people are so valuable. We may sometimes hate them, and we talk stink about everybody, but if you know your community, you'll be able to serve your community. And I'm confident that that's the benefit we'll get from your expertise. So you ask what we really have to do at the state level. We have to be pretty conservative right now to decrease spread, because we're a rural state. Everyone's very aware that we've had a healthcare provider shortage for many reasons. It's just not easy to bring healthcare providers to rural areas. We've done all that we can to try to keep them going, to add nurse practitioners, to add volunteer physicians. And by the way, we got 5,000 physicians that have licenses that don't practice right now. I'm going to be encouraging them to come off the bench. If you're out there and you have physician friends or nurse practitioner friends who aren't working, please send your information to Healthcare Association of Hawaii or to my attention. Is it okay to give my Twitter account? Whatever? So it's simple. It's at LTGov Josh Green. Send me your information and we will catalog it if you'd like to volunteer, and we will give you the right connections. But right now, paying for the short period on business, on economy, trusting our congressional delegation, which is doing it, and we've seen the real results. Like you said, the president just signed the bill, and we quickly recover, and people don't panic. Don't panic that your IRA is down, because some of this is going to come back. Only panic if your kapuna gets killed. Okay, that's the panic. So we got to keep our eye on that prize, which is decreasing spread and maybe staying alive as a business. And if we do that, we're going to be fine. These things do tend to burn out over 3 to 4 months. That's always been the case before. So I don't expect it's going to be that different. Hopefully it's not.
Okay, great. I'd love to get the questions, although we've answered a bunch of them already. I want to just kind of end this part of the program by saying what I need from you. To be honest, I need a couple of things. First of all, I need your questions and your input. Your questions, yes, we want everybody to know what's happening, what I know, as I said at the beginning, what the LG knows. We want to be straight with everybody. It's the only way to do this. But more, I need your input. I need your guidance. I need your advice. Where do we spend $1 trillion? What's the wise way to do this? What are the balances? What are the needs? What are the specifics in your community that maybe I just haven't recognized fully? Your input is valuable. I need your partnership. We're all in this together. As I said at the beginning, we're all partners in this, and we've got to treat it that way. It's not like I fly away to D.C. 5,000 miles away and hang there and don't think about what's back at home and see you every once in a while. It's a full-on partnership. It's more important than ever. And then finally, I need you to not give in to misinformation and to fear. In the past 5 days, I've heard 2 mega rumors. I knew they were wrong, but they were sweeping the country, sweeping the state. One is about Matson shutting down. That was a good one. And then there was one about a national lockdown. Neither of those is true. Now, on the latter part, worst case scenario, it could happen. So let's not be shy about this. We don't know where this is going to go, and there may well be remedies that have to be taken that are more severe even than where we've ended up so far. But nonetheless, that was a rumor. And then obviously fear. Information, plain talking, knowing what the situation is, knowing what the plan is, knowing what you can do to protect you and yours. And that's how we avoid fear. So please don't give in to fear. And then finally, just help each other. This is not, government hasn't, your government, which is exactly what I said, your government has an obligation to help all of us, but we can also help each other. Your government cannot do it all. If there's capacity for you to help out a neighbor with child care or with a job, well, he or she is, having a tough time, let's do that. We do that really, really well in Hawaii. So I think we all know that. Okay, Josh, that's that part. And we're going to whip some questions here. We've got a ton that have come in.
Fire away.
So apologies to everybody. We're going to do this pretty fast because we've got a lot. So let me just start out. Some of these we've answered already. Let me just get on my questions here. Okay. Let's see. What's the process
Speed
for
dating question?
yeah.
Right, okay.
What's the process for getting tested if you have symptoms? I think we've already answered this. You got to go through your primary health care provider, right?
Yeah, a doc should order it for you, or your nurse practitioner, and you can go to one of the testing centers.
Okay. And if you don't have a primary health care provider, 808-586-4586. 808-586-4586 will lead you into the process of actually getting that.
That's right, and you can also, our community health centers are very available. They take people, you can sign up with them and go see them. They have a sliding scale. They will help you expedite this. But please call ahead if you can, because if you're super sick, you got a fever and you cough and stuff, we don't want people going into the office. We might prefer to either advise you to ride it out if you're not going to die of this, and or go to one of the testing centers where we can send over or fax over a quick order to get you tested.
Okay, cool. Let's see, what is the state of emergency medical supplies, especially respirators? Can the federal government get something started to get those supplies in the pipeline? I think we answered this. The state of supplies, in all honesty, is that although we have adequate respirators today, in a surge environment, we could well have trouble with adequate respirators, and that's one of the primary areas in the bills that we passed in Congress was to jumpstart the distribution of respirators around our country as in a worst case scenario. You also may have seen that the president today invoked an act called the Defense Production Act of 1950. This was really intended for the president to be able to essentially tell industry to manufacture and distribute essential products in wartime. This is wartime, as the president, I think, accurately said today. We have to treat this from a mobilization and distribution perspective as if it is that. And so that is a very high priority to make sure medical equipment, including respirators, is out there, especially if we have that surge. What is the status of unemployment funding? Can it handle the shock of 25% for a few months? I met with the director of the Hawaii Department of Labor 2 days ago, and his answer was, yes, we have sufficient reserves for now, but in a huge surge of unemployment, which frankly we are expecting, and I don't think we can expect otherwise, they would start to be strained, and that's also one of the major issues that we tried to address in our federal bills that were just passed. Both bills contained major jump starts for unemployment insurance, and as a matter of fact, I just got a message from my Speaker of the House, Pelosi, before I came on, basically saying that in feedback from all of the members as to what we should put in the stimulus, unemployment insurance was way up at the top, so we probably have to take another bite at that. By the way, the other one was small business. Okay, Allison, will you be working with the superintendent of the Hawaii Public Schools to help parents if they do not want to send their children back to school on March 30th? I would like it to be an excused absence and not count against our children if we as parents do not want to send our children to school. Well, I think you already answered that it's extended to April 7th. I try very hard not to get in the way of what the state is doing on state issues and to micromanage. So.
Yeah, the reason I like being on these shows with you and other leaders is because I can text her directly. We have a good relationship. We have a cabinet meeting tomorrow. So I'll bring that up with Christina Kishimoto. She's a very good person and smart, great director, superintendent. We're going till April 7th, and they're gonna give us updates in advance whether these things are going to be extended. But I think there's going to be a lot of relaxed rules on things like unexcused absences. We need to relax the rules on work notes for people not going to work, especially if they're in quarantine, because we don't want them to have to go to a doctor's office and make other people sick. So there's lots of interesting reasons to do that.
Okay. When will Governor Ige sign up Hawaii for the SBA disaster loan program? More than 40 states now have access. We talked about that quite a bit. Governor Ige has now submitted that declaration, and we expect to have that approved in a couple of days. Then small businesses can apply for that assistance, and I very much want to help small businesses get through that process. Yeah. All right, let's see. I have a friend getting married at a golf course this weekend. The golf course is refusing to cancel the wedding and refund my friend or even give her a credit to be used on a different date. Can anything be done about the golf course from putting their workers, the guests, and the public at risk? Well, I think the first answer is that golf course shouldn't be sponsoring a gathering of 10 or more, right? So
they've been given a mandate by the government, and you should not be liable. You should be eligible for a reimbursement, and that's something that has to be handled at our government level.
Right, exactly. And I would frankly hope the golf course would understand that, and you know, I assume that there's a deposit at risk, and not hold them to that. And
reschedule it, I think.
Or else go to the beach and get married with 2 people. Just that might be nice too.
Yes, or 9, but stay 6 feet apart.
Yeah, exactly.
Yeah.
Let's see. How can we stop vessels from docking in Hawaii? Well, let me take this, and you can add these. First of all, we can stop vessels from docking in Hawaii. It's a little bit of a combination of federal law through the Coast Guard and state law. As I recall, first of all, almost all vessels have ceased any cruises to Hawaii. We had 2 vessels that were going to stop here for humanitarian purposes. These are vessels that took off, never intended to come to Hawaii.
Right.
And they got stuck when they were denied entry in other places, and they wanted to dock here and offload their folks and go directly to the airport and get on planes. And today the State Department of Transportation said we're not even going to do that because our resources have to be committed elsewhere. There are a couple of other vessels that are coming into port, as I understand it, from the state DOT, simply for refueling. So they're not getting off. And if anybody does get off, if they're not supposed to, they are tested.
Yes, fuel and food. We will make sure we can accommodate, but people have to realize if we were to allow people to disembark, which is not even a good idea, and if we were going to test them all, it could take hundreds of our healthcare personnel to process people and make sure we were adequately safe. It's just not a good idea. So they're going to go to larger states, and then there's going to be large disembarkations and quarantines if necessary.
Okay. Why is the rhetoric to continue to test? I'm concerned that we're spending so much time focusing on testing for COVID-19 that resources we need to test for other viruses will not be available. I think we answered that. I think it's critical that we know who is sick, and we have to do that in order to run the program.
Right, and once we get a good background and have some data, just basic data, then we won't have to test as much. Then we can, of course, at that point, know how sick people are actually getting, what our expectations are for the hospitals, and so on. But the fact that we had no testing for a period of time was a problem.
Right. Okay, are they going to make some type of announcement for unemployment benefits? Will the Department of Labor provide an FAQ page on their website? They actually have done this, and if you go to their website, they have all of the information that you need. Their website is labor.hawaii.gov. Labor.hawaii.gov. Department of Labor, like all of the other state agencies, prefers very much online applications, online processing, and/or phones. But online is preferred by far because, frankly, their personnel are very strained right now with phones. They really would prefer you not come in at all. So please, for anything having to do with any government, try to figure out if they have an online or a phone option, because first of all, there is a danger both for them and to you to come in, and second, some of these state and county government agencies have in fact downsized to telework.
Yeah, a lot of people are at home. So even my office, I mean, we just do name changes and some basic paperwork. We're still rotating people in as necessary, but for essential services, we're trying to prevent spread just like everybody else.
If other ports are turning cruise ships away, why are they allowed to dock in Hawaii? The request by Lieutenant Governor Green should have been pushed for White House approval. I think we've already answered that. We are resolving that as other places are.
Yeah, I called the White House.
Right. Well,
yeah.
Hey, I think that's we're not different from the rest of the world, and that's what many of the folks are saying is, why is what's good for the rest of the world not good for us?
Yep.
When do we call it and say that no more testing is necessary for individuals with COVID-19? My understanding of the pandemic is that there will be a point when testing is discontinued.
Well, testing will always be relevant, at least in the hospital setting, because there will be times, let's say a certain person's in it, let's give an example, a 70-plus-year-old person, they're having a lot of breathing problems, they have underlying lung disease, but we want to know what the course of their illness will be. We want to know whether they have a pneumonia versus a virus. We want to know whether they have no infectious disease but are having a heart attack. So we'll do lots of different kind of tests. And look, we've had pandemics of the flu before we still test for the flu. The time will come that we don't have to do basic testing for people with minimal, or we certainly are not testing people with no symptoms, but just minimal symptoms or moderate symptoms, because we're going to tell all those individuals to stay at home. But we still need to have some idea. Do we have a big surge on Maui? Do we not? Do we have a big surge among children? Do we not? Do we have to get ready for a gigantic lift, or do those resources get better spent in other parts of the country? All of these things are very relevant. And so we are in still a data surge situation. And it's really not taking away from any of our services in the hospitals at all, because we haven't had a big surge of intensive care unit patients yet. We are getting to the place where we're watching other states see that surge, and I think as you illustrated very well with that curve, we're going up this mountain. When we start peaking, yes, then we will move a lot of services. For instance, outdoor facilities that we're activating, I'm using that to shake off the rust a little bit, because you could see us recommend setting up a big mobile hospital if we have extra needs. We have that kind of capacity. You could see us transition outpatient tent centers to just have for basic transitional care for little nothing stuff like strep throats and the easy stuff, while all of our healthcare, the key stuff, is in the hospital. So there's a method to this madness. When I ask for a lot of testing, it's also to set up other structures of service.
What is your understanding of the conceptual framework behind Congress's current and future efforts to mitigate the potentially disastrous effects of this pandemic on Hawaii, U.S. and world economies? I think I tried to speak to this. Our goals have to be really fourfold. We've got to take care of the science. We've got to take care of our hospitals. We've got to take care of social services, the social safety net, and we have to take care of our economy, especially our small businesses. And we've got to focus on all four of those at the same time. Now, how we apply that in the context of some very complicated bills and complicated programs, and move with with alacrity, as I read somewhere,
Yeah.
meaning really, really fast. That's a challenge too, because one of the debates that we're having, and I was on the phone today with somewhere around 100 of my colleagues with some of the people that were leading our government administration during the 2007-2008-9 recession, and one of the things that those folks said. So we're talking about former secretaries of Commerce, Secretary of the Treasury, Chair of the President's Council on Economic Advisors, and they were on the front lines, and they said one of the things you really have to think about is, don't make it complicated. Get the money, get the federal funding out there fast. Don't put so many conditions on it that you're so worried about it going into the exact right hands that you hang it up for 2 or 4 months in Washington. That's not going to work. One of them said, let the states do that. Give the states the discretion, and I think there's a lot of wisdom in that. Each state is different. So my conceptual framework is, how can I take care of those 4 areas and do it really, really fast? Why are tourists still disembarking off cruise ships in Hawaii? They're not. Is there relief for healthcare workers? I'm not sure exactly what that refers to. I think I would say, from my perspective, healthcare workers are one of our top priorities. I mean, they are on the front lines. They are the most essential workers in our country in this battle, and we certainly are trying, from a federal perspective, to be sure that they are fully equipped and fully supplied, and that there's enough of them. So I don't know if you have a particular comment there.
I think there is a couple additional comments. For instance, we will give people workers' comp if they get sick at work over the course of the coronavirus. That will be a workers' comp claim that we're capable. We'll also be able to do temporary disability. We'll also give people some expedited testing if they're workers, because if we know that someone's sick and they had a cold, it's good to confirm that they have a cold and not coronavirus, because we can go back to work sooner. But it's just it's just one of those things. We have to put that discipline out front, because they're going to have to take care of the other 1.3 million people. So there are lots of considerations. It's a lot of overtime. And the one thing about the healthcare industry is it is going to be the one industry that probably doesn't suffer economically. So from that consideration, it's always an honor to be in the healthcare industry and be wanted and needed, and is not going to probably need a bailout.
Do you think that there's a demand for healthcare workers because of this in Hawaii? I mean, are we undersupplied in the healthcare worker department?
There are massive demands. We're testing right now. This is a key test with a virus that's not nearly as bad as some of the others, like Ebola and so on, that would kill you straight away. But it is very significant. When we see this kind of test, we test the structure of our systems, and the healthcare system has been tested many times. We're still the healthiest state. We have the longest lifespan. It's very interesting, even though we often complain that we're short on healthcare providers, because we do other things right in our state about healthcare. But this could be a very interesting test, and hopefully not a calamitous one, because by being too short of healthcare workers, if we see a super surge of cases that end up in the ICU, we'll see fatalities, and that would be tragic, because we've been kind of screaming out for some help on the shortage.
Yeah. One of my colleagues today, in the call that I referred to earlier, raised the question of whether we had any established labor exchanges in our country. So kind of stock exchanges where people that have been laid off or downsized could actually find. It's kind of like a super job fair, right?
I like it. Yep.
And it strikes me that, and this was a comment by one of the folks that wrote into the question, is, well, are we providing opportunities for the people that are actually significantly impacted, for example, restaurant workers and hotel workers, to actually work in healthcare on a temporary basis? Are we making it easy for them to do that? And sometimes we put up so many hurdles, some of them legitimate. I mean, you need to require a certain degree of training and expertise to work in healthcare, but on the other hand, there's a crisis here, and can we put some folks back to work in another area?
Interesting you mentioned that. So before we decided to not allow those 2 cruise ships to disembark people to go to the airport, we were going to have to screen them, and we were going to need hundreds of extra screeners. So I have a meeting tomorrow with Local 5, the hotel representatives for the hotel workers. We were planning that discussion. We're still going to have the meeting to see if hotel workers could be quickly trained for some of the basic health care. And they can. Super smart people. and some basic structural training that needs to be done. Not maybe to swab people, but to do a lot of the health intake, ask the right questions. So that was planned to have a one-day rapid training, which would be tomorrow, Thursday, from hotel workers to then make sure they're still employed. They do some work in doing outreach if they chose to do it, and then they would be working and getting paid, in this case through health appropriations and emergency appropriations as we disembark. I still think it's a good idea, and a lot of people are cross-training these days, and they're going back to community college, and that may be part of the program where we give people some extra capacity to get extra training.
Yeah, that seems like a really good idea to formalize that a little bit more, and I'm sure we can work that into the stimulus as well.
Yes.
Okay, let's see. A bar in downtown is planning to host a party tonight open to the public in an effort to prevent the further spread. Isn't it in the state's best interest to cancel this party? Is there anything that can be done? Well, they're not supposed to be doing that, right?
Yeah, I just saw a thing come across the wire. I'm checking this periodically online because it's happening so fast. And so apparently, they're if restaurants defy this order from Mayor Caldwell and Governor Ige, they're going to get busted. So I think that there will probably be law enforcement going to restaurants if there's a big rave going on.
Okay. I got to say this, again, trying to be honest with everybody. I still see instances throughout Hawaii of people that just don't believe it, or if they believe it, they think it's not their problem, or if they think it's their problem, they don't care. Some real congregation going on. I was sitting there, for example, today. I've had, as a lot of people know, concerns with tour helicopters for safety and community disruption reasons, and there were tour helicopters going overhead today. And I thought, well, that's 4 to 6 people in a really confined space. Should they be doing that?
No, because they're 2 hours in together. Those individuals could all spread it, and then 6 people can become 12, can become 144 real fast. So this is the time when people need to calm it down, have absolute social distancing, and we really are in a single organism when we have these kind of outbreaks. And if parts of the organism don't behave properly and allow, because of neglect or disregard, allow spread, it'll be like putting a new fire out, and another fire out there, another fire out there, and eventually those fires become forest fires, and then they burn it all down. And so this is not the time for that. They're hurting themselves long term, but they're hurting everyone else short term.
Okay, when will flights to Hawaii from domestic and other places be suspended to protect us? I'll take a shot at this. Again, I think we have to say that there may come that time. But again, it's a question of what we were talking about earlier. Can we mitigate risk from those flights by inspecting people going on and coming off, which the state is trying very hard to accomplish right now,
Yes.
and maintain some connection to the outside world? We forget that is our connection. So you can still take a truck or a bus from North Dakota to South Dakota. Right. You could easily ask, well, why aren't we suspending the bus from North Dakota to South Dakota?
Right.
Same idea. We're trying to maintain a certain level of interstate commerce, and this is our only choice here, other than for ocean shipping. So that's my answer. Is that I don't, we haven't gotten to the point where we have to take such a severe measure as to cut ourselves out from the entire outside world.
Yeah, it's a very tough question because I understand people's empathetic desire to do that because they want to protect their families and whatnot. A couple things. First of all, families are going to have to get back home under some circumstance. And we can self-quarantine, and that's fine. People coming back may have to quarantine for 2 weeks, and that should be sufficient. Other questions are, but why have 10,000, 20,000, 100,000 individuals come in? Well, then it does become a resource question. If we only have, like I mentioned earlier, statewide 561 ventilators, if half of them end up, God forbid, being occupied by individuals who traveled here, I mean, our number, 561, is one heck of a lot smaller than the tens of thousands in big states. So we may not have the capacity. Those are some of the big questions, but we have to be very prudent. It's also sorting itself out because there's such a low demand right now that the airlines themselves can't even feasibly have their fleets coming anywhere. But it could happen. This has been ramping up day over day. A week ago, I would have never imagined that there were such swift and significant social distancing measures getting put into place in the country.
Right. And in fact, literally, as we've been doing the show, breaking news from Hawaiian Airlines. Hawaiian Airlines reducing flight schedules system-wide. airline further adjust network due to declining demand and travel restrictions. So they obviously have felt that demand reduction, and I think they are legitimately, as part of Hawaii, concerned about the impacts as well. And they need help, as do our airlines. They're part of the people that are the most impacted. Of course, Hawaiian company, 7,000 employees. So
there's going to be a bailout necessary, and I know you guys are on it. And when it's a bailout, people, that sounds like a dirty word, but it's just citizens. I mean, I think it's going to be jobs and survival, and we're going to want the airlines.
Well, I think the question there is, and it's a good overall question that we're dealing with in Congress right now. I'm dealing with it myself. Some of the quote unquote bailouts have been kind of like throwing cash at the companies, and you figure out how to save yourself, and maybe they did it, but they're I think people are still very angry at some of the bailouts because they feel that the companies actually profited from it. And I think that when we help companies, we have to put conditions on it. Like, we have to know, for example, that money is going to keeping employees on the payroll. We have to know that it is not being used for stock buybacks, and really to advance the company's own interest over the long term. So that's a challenge that we've got right now. Okay, how is COVID-19 worse than SARS? That's your question.
COVID, how's it worse than SARS? Well, there's a lot more people. It's spreading a lot more, and frankly, because it's spreading a lot more, it becomes a larger challenge for us socially and economically and response driven. There's so many fewer cases of SARS that we really just we were able to see it burn out, and this one got broad and it became this global pandemic. So very, very challenging.
Okay. By the way, is SARS still around? Is SARS still out there, or is it?
It's very likely there are still cases of SARS, but there's so few of them that it's not something you're going to test for routinely.
So, I guess on the bright side, it's conceivable this could be that same virus, although we can't plan for that right now.
No, this is highly likely going to burn out. Like, we're seeing it starting to burn out in China. In South Korea. So it's likely it will be endemic, meaning it will be among us on some level. What I expect you will see is, after this year, you take this to the bank. 2020 is going to be described as a time, coronavirus is going to be person of the year, for sure. And that's what we'll remember about 2020 also, for sure. That and probably the general election, I would guess. But look, after this, next year, when you get a severe flu, if people are really feeling awful and they've got symptoms that are more specific to what COVID-19 has been rather than influenza, I won't be surprised at all if we will do a test for flu, but we'll also do a test for COVID-19. And it'll be easy then, and there won't be a big rush, and then we'll know how to treat you.
Okay. Do we have a percentage of people who have no symptoms?
Highly likely. Or symptoms that are so mild, scratchy throat, little runny nose, that'll be it.
But they're still contagious.
Yeah, they may have a little cough, a little dry cough, and they are contagious. That was one of the things. People were saying that you absolutely could not spread it in the first month of this disease unless you had symptoms. And so then all of a sudden someone said, well, you can actually spread it before symptoms. It turned out those patients had very low-grade symptoms that we thought were spreading it even though they were asymptomatic. They weren't asymptomatic. They had a little bit of dry cough, and they were suppressing it with cough suppressants, or they had a little fever and they were taking a bunch of Tylenol, and they therefore didn't have fever. So, we shouldn't be overly dogmatic about some of these things. The big picture, social distancing, getting our hospitals ready. That's really what it comes down to.
Okay, and I think speaking of that, social distancing, what are we doing for the homeless population? How do we reach them? Is this a special risk, or, I assume that the principles still apply, but
yes.
Are there special techniques, I guess I would say, to reach that population? I know people are trying very hard, Institute for Human Services, other people that are out there in the community trying to reach the homeless population, offering, Mayor Caldwell has talked about a shelter here in Honolulu that's dedicated to housing and caring for folks without homes who are at risk or who have contracted them.
Right, so Mayor Caldwell did announce a project today. It's going to be run by H4, which is the nonprofit I've helped start, and we got a lot of resources today to do it, funds from nonprofit sector and Queens and so on, and very happy that he's done that. I'm proud of their administration for setting aside those beds. 29 beds, going to be specific to that. We also bought a mobile unit, which we will launch next week, to directly go to the homeless community, and we're doing outreach also individually, although it's challenging because, as you said earlier, one-on-one outreach can incur spread. So we will be doing that, and people will be gowned up, and they will be offering testing for any individuals that are symptomatic, and then people who are symptomatic, we will give them a room for the 14 days as though they have a house. I've been fighting for a long time for tiny housing villages so we could be ahead of this. We had a lack of foresight and didn't do it, unfortunately, because that's a different paradigm and a different challenge. But the reason to beat homelessness is to be humanitarian and caring about people and to avoid this exact circumstance. In San Diego, they had an outbreak of hepatitis A, which killed 20 people. I've been saying this was going to happen, and now it's happening, and it will crush us if our homeless community gets sick.
With the news of 2 House members testing positive, are you concerned that you came into contact with them or anyone they are associated with? And will you be tested? Referring to me.
Yes.
So 2 of my colleagues in Congress were diagnosed positive with COVID-19, including one that is a friend of mine, Ben McAdams from Utah. I don't know Mario Diaz-Balart quite as well. I think we are all concerned with this in the U.S. House. This job is a contact job. I mean, we have people in our offices all the time. It's a Hawaii office. Hug, kiss, shake hands, and I think that Congress is, in all honesty, sorting through some very, very difficult decisions about how we function in Congress. I think every one of us as members of Congress are monitoring ourselves very carefully. We're trying to be sure that we make responsible choices. My office here, for example, is a skeleton crew physically. We're doing mostly telework at this point. So we're trying to do the same things in my office, and I don't go to big meetings, and I don't go shaking hands around the neighborhood right now. I hate that because I love that kind of politics, as do you. We both came out of the same school on that, and we're trying to figure out. For example, we obviously have to go back to Congress and vote at some point on the stimulus package and other major legislation, and we're talking about things like only 10 people coming into the chamber at a time, and none of us talking to each other or seeing each other, and we just vote and leave, which is not how we do business. I mean, usually you go to the chamber to vote, a full house, and that's where you kind of see your folks and do your business. As to whether I'm going to be tested or not, I'm following the exact same advice as everybody else. I have no indications that I should be tested yet, and so I'm not going to go down there and waste the test, but I'm certainly watching myself.
That's right.
Let's see. Why is it that travel has not been temporarily stopped, since the majority, if not all, of the cars in Hawaii stem from travel? I'm not sure about that. I think we answered that question. I think I will leave that one at that. We're trying to find the right balances with travel, and one question that relates to this is somebody asked, why aren't we suspending the U.S. Postal Service and package deliveries? And I think that the answer to that is that there's a minimal risk from actual mail.
Yes. Yeah. The virus, it barely survives on smooth surfaces for long. Definitely on rough surfaces goes away. You wash your clothes dead. So not a big concern there. There are other diseases that can stay on top of surfaces for a long time, but this isn't one of them.
Okay. Why aren't the beaches being closed?
They should be. In fact, I intended to say that tomorrow on television, that we should immediately close Waikiki Beach and the other beaches. And so I hope that people will send messages, and I will, of course, to the mayor and to the governor. That should be done now. Social distancing means everywhere, if we're going to do it right.
Nothing magic about a beach.
No, beaches, I mean, if you're within 6 feet of somebody, or they're walking by you, or you decide to make out with somebody, you're going to spread it.
If Las Vegas can do a total shutdown with 48 cases, why aren't we shutting down our state? Well, I think we're largely shutting down our state.
Yeah, right? We're pretty much shutting it down.
Yeah. I think Las Vegas is certainly taking the measures it thinks it needs to. It does have people driving in and out of the state, so they haven't shut down their interstate commerce. I think we're all trying to make the responsible decisions for our own jurisdictions.
That's right.
How far away are we in Hawaii from widespread availability of short time frame COVID-19 testing, like one day turnaround?
A week, I think.
Regarding utilizing the military bases in Hawaii for operational services with state and hospital, are we dependent on the president to activate their services for our state needs? Can we either ship offshore, like will be on the west and east coast of the USA, to supplement our hospital beds in case needed? Well, yes, I mean, technically we are dependent on the president and the Department of Defense for the mobilization of military forces. But I will tell you in no uncertain terms that the military is our full partner on this, especially our military in Hawaii have been fantastic on this. I do want to also say they have their own challenges. Of course, they practice and train and live together in very close quarters, and they're having to find their own solutions. And so, and they have offered, for example, emergency supplies out of their own stockpile of masks and other things. As to the hospital ships offshore, I'm sure they would be here if that need arose. We don't have that many hospital ships. But I'm sure they would be available if necessary.
Yes, absolutely. And right now also, General Hara is running our emergency operating center, so I mean, we're fully integrated with the military.
Okay. Why are we letting in cruise ships? Why is Hawaiian Airlines offering promotions? I think I answered that pretty much. Hawaiian Airlines is downsizing. A lot of these folks, in all honesty, LG, are essentially being taken, asking the same basic question, which is how tight should we shut down? And I think, again, I mean...
Shut it down tight, best you can. Yes. Shut it down and try to survive for 6 weeks and count on support, count on healthcare services. We'll provide better healthcare services if we have less spread, I guess, is the biggest message.
Okay. Yeah. What actions, if any, are being taken at Honolulu International Airport on passengers on all the international flights we have arriving daily? Well, the state is moving as fast as possible, I think, to screen them.
Yes, that's right.
What will the Fed and state government do when it comes to non-payment of bills? No further guidance from the president or the governor on those that are or will soon be laid off in the near future. There are a range of forbearance considerations under consideration in the federal side, and I think in the state side as well.
Yes.
For those that genuinely need it. To me, the challenge there is to make sure that those that genuinely need it do get a break, but those that don't pay their bills. Because I don't want this to be an excuse for everybody not to pay their bills. That shuts down the economy pretty well too.
I heard earlier tonight, like for instance, Helco is not going to stop people's energy or electric if they're already going through the 17th of April, and they'll probably extend that. So there's going to be some latitude to help people out if they're in deep trouble. And I think we have to not foreclose on anybody in their mortgages. But if you have resources, keep your life straightforward best you can.
Okay. We've been going an hour and a half. I still got a bunch of questions. Can we take a couple more? Or what's your time?
Take a couple more.
Okay, cool. And then I think we're going to have to end it and try to answer these questions for folks outside this telecast. Let's see. I'm going to try to pick out some that really just we haven't dealt with yet. Can we institute a temporary UBI? I think they mean universal income, $1,000 a month for every American over 18 years old, limited to the period of the COVID-19 pandemic. That's one of the proposals that's on the table for the stimulus, and the president has said that he thinks we should make $1,000 cash payments to folks. I'm not convinced that's the right thing to do. If you give people $1,000 and they don't have anything to spend it on, that I think what we're trying to do is keep people employed, so that they're actually making money off of the businesses or the governments that they're working for, as opposed to just a handout. It might well be at the end of the day one component of a stimulus package, but so not off the table.
Sure.
What can we do to keep our jobs when my employer is still expecting us to go to work but are kicking or out of school? Nobody is available to help us with our kids because they don't want. This is the terrible dilemma that many, especially young families have. Child care is so tough to start with, and people do need to keep working. I'll just be really honest with the person that wrote this. I don't think I've seen a good answer to this one yet. I think clearly we need to rely on our communities, our friends, our family in this situation. Certainly on the federal government level, we're trying to figure out, well, can we actually finance and assist in legitimate child care needs so that people actually can have their children cared for.
And it's a super challenge right now too, because just like we don't want a cluster of 10 adults, we may not want a cluster of 10 children all at the same daycare center, and we don't want to use the usual mechanism which we normally do, which is our kapuna taking care of them either. So we are really between a rock and a hard place, and so employers, I think, are going to have to be as understanding as possible and probably not penalize anybody for time away from work right now. Honestly, almost all activities are so, except for totally essential activities where, like, you have to have a police station open or you have to have a hospital ward open. A lot of things are going to get quiet, and that's why we'll be understanding, I hope.
Okay. All right. How are we working to protect our first responders and ER staffs?
They're getting as much PPE or personal protective equipment as we possibly can muster for them, and if they don't have it, then we can't force them to do the tests or things that put them at risk. Also, we have to test them earlier and often so that they can continue to work and be out there and not spreading disease. And if people have to be on isolation, we try to move them into an administrative capacity in backup and support of all the others that are providing the care. This is the biggest issue that you often face in pandemics, which is if you lose 35% of your workforce and it's your first responders, you can't do anything. You get paralyzed, and then it cascades the problem. So that's what we're doing. And again, hospitals, that's why we have the stockpile of the personal protective equipment that goes mostly to hospitals and first responders.
Okay. Let's see, I've just got one or two more because we actually have gotten to the end of the list that came in during the show. If my income heavily depends on commission, would I qualify for unemployment benefits from reduced income? Generally, yes. If your employer is recognizing your income and paying unemployment insurance on your income, that's kind of a detailed answer. But the best thing I can suggest for you is to get in touch with the Department of Labor and answer that, or ask that specific question at the contacts I did earlier, which is labor.hawaii.gov. I think that's it. Labor.hawaii.gov. Sorry, there was one more I just wanted to. Is Matson still making shipments? What if Matson workers get sick? Well, I think this was kind of asked in the last week with the rumor. Yes, they are. And General Hara said in no uncertain terms, as the director of Hawaii Emergency Management, that the supply chain is intact, meaning that goods are getting on ships and coming down to Hawaii in the normal course. The reason we're all feeling the shortages is because we're all raiding the stores. Not because the goods aren't getting here. And so, that's one thing that we can all do to help each other is take what we need as opposed to a 6-month supply.
Yes. Yeah, keep the lid on it, guys. Please don't buy too much toilet paper or peanut butter or Simon, because we're going to be okay. We really are going to be okay. And hopefully this is not going to be a 4-year thing. But please take every precaution to do social distancing. Be really smart about that. Don't get sick yourselves. If there's fewer cases to spread, it will drop down and we'll beat this thing.
Okay. All right, Lieutenant Governor Green, I think that's it for tonight. Any closing things you want to say to the gang?
Just thank you. Thank you for for welcoming me, Ed, and thank you for everybody being understanding. These are very tough times, and I know how much sacrifice you're going through. We will try not to make any precipitous decisions. The main thing is to keep people healthy and alive so that we all recover together, and that's what you heard tonight.
Okay, well, thank you so much for joining me and for sharing your expertise and your thoughts on this. It's been great and incredible to have you. Certainly you found the right time for your background and your expertise. I'm sorry that happened, but I'm glad you're in the job to give that kind of guidance. So carry on. We'll continue to try to partner with the state administration and our county government and everybody here. I would just say to folks again, as Josh said, this is a public health crisis and an economic crisis. It is serious. There are things that each and all of us can do and should do to minimize that crisis. There's much that your government can do and should do. And my and Lieutenant Governor Green's commitment is for your government to work for you when you most need us. He at the state level and me back up at Congress. And so I would say again, my continued goals are to give you the information you need, to ask your questions, and to solicit your input. So as you've had any further thoughts during the course of our top story, Please send them in. If you have any questions, please send them in. You can reach me at case.house.gov. Case.house.gov. That'll get you entry into my office. We welcome your thoughts. Thank you very much for joining us, and to each and all of yours, be well. Aloha.